What if a common household item, something maybe as simple as a specialized lamp, held a key to managing something as vital, really, as your blood sugar? Imagine a world where light isn't just for seeing, but for healing, maybe for re-energizing your cells, and perhaps even for, profoundly optimizing your metabolism. Today, we're embarking on a truly fascinating deep dive into the emerging science of red light therapy, or RLT, and its surprising, yet increasingly substantiated, connection to how our bodies handle glucose and regulate metabolic health. Our mission in this deep dive is, well, to cut through the noise, really, to extract the most important nuggets of knowledge from a stack of recent cutting-edge research and expert insights so you can truly understand what this could mean for your own well-being. And before we even begin, we really want to extend our sincere thanks to Dan Blackburn of redlighttherapy.rehab. That's redlighttherapy.rehab. He meticulously pulled all this incredible research together and created such a comprehensive review, which honestly forms the backbone of our deep dive today.
Their diligent work has given us just a fantastic, robust foundation to explore this intricate and exciting topic. It's truly a journey into how specific, precise wavelengths of light might offer a gentle yet powerful shortcut to better metabolic health, especially for anyone curious about optimizing, their body's internal machinery. So, after that intriguing glimpse into the promise of light, let's pull back the curtain and really unpack what red light therapy is. Because while the concept of light as a therapeutic agent might sound a bit futuristic, its underlying principles are surprisingly fundamental and are already quietly transforming various areas of health and wellness. When we talk about RLT, we're actually referring to what scientists formally call low-level light therapy, or maybe more broadly, photobiomodulation. Essentially, it involves exposing specific areas of the body, or even the whole body sometimes, to very particular low-intensity wavelengths of light. We're primarily focused on the red and near-infrared spectrum here. We're talking about a pretty precise range, around 600 to 900 nanometers. And this specificity in wavelength is crucial, right?
Because these particular light frequencies have this unique ability to penetrate deep into tissues without generating excessive heat, reaching our cell's most vital components. Now, RLT isn't entirely a new kid on the block in the health and wellness space, not at all. For years, it has had established uses, proving effective in areas like, say, stimulating collagen for skin rejuvenation, accelerating wound healing by boosting cellular repair, and even providing significant pain relief for muscular and joint discomfort. We've seen it pop up in clinics, spas, and increasingly in popular home devices for these very reasons. But what's truly exhilarating, what really leaped out from this latest wave of research that Dan Blackburn compiled, is the emerging and compelling data that suggests RLT may also directly and profoundly influence how our bodies regulate blood sugar. This discovery opens up a whole new, deeply impactful frontier for light therapy.
Yeah, this is truly a potential game changer because we're moving far beyond just, cosmetic fixes or surface wounds. Here, we're discussing a non-invasive method that seems to fundamentally influence how your body processes its primary fuel glucose. This isn't just treating a symptom, it's potentially retuning a core metabolic engine. For many people, this could be a truly significant discovery, offering a completely new, gentle pathway to manage one of the most widespread and challenging health issues facing populations globally, blood glucose regulation. And this is especially important for anyone already dealing with diabetes, prediabetes, or maybe those who might be at heightened risk of developing these conditions. You've probably noticed this connection gaining considerable traction lately, right? And in recent scientific literature and even some mainstream media coverage, which makes it absolutely vital for us to examine the actual rigorous science underpinning these claims. The big picture implication here is profound. It suggests a simple, non-pharmacological approach could make a real, tangible difference in managing metabolic health day to day.
That's a really powerful claim, impacting fundamental metabolism like that. So what specific research really put this idea on the map? And, how robust was it?
Well, the biggest splash in this area, it really came from a landmark study published just this year in 2024. It provided what its researchers called the first clear evidence that red light can actually blunt the rise in blood sugar after a meal, or in this case, a glucose drink. And this was far from just an observational study. It was a carefully designed, randomized trial. It involved 30 healthy adults, none of whom had a diagnosis of diabetes. The study design was quite precise, actually, quite elegant. Participants underwent standard oral glucose tolerance tests, OGTTs, on two separate occasions, once with prior RLT exposure and once without it, or with a placebo light for comparison. And the specifics of the light application are really key here. They used a very precise 670 nanometer wavelength red light. They shone it on the participants' bare upper backs, the duration of exposure, just 15 minutes. And crucially, this session was administered approximately 45 minutes before they consumed a standard glucose solution. For the control group, they received what amounted to a sham, a placebo light treatment, ensuring a true comparison.
Okay, so this raises an immediate question then.
Yeah.
What exactly were these striking results that came out of such a controlled setup? What did they find about the impact on blood sugar?
The findings were, they were quite compelling. They immediately caught the attention of the scientific community. On average, the red light group's blood glucose levels rose a remarkable 27.7% less over the subsequent 2 hours compared to their own baseline response without the light.
Wow.
Think about that for a moment. Nearly a 30% reduction in the post-meal glucose surge from just a 15-minute light session.
That's significant.
It really is. And it wasn't just the overall rise. Their peak blood sugar spikes were also significantly reduced. The maximum glucose level observed was approximately 7.5% lower in the red light group than when they weren't exposed to it. So, to put it simply, a single brief 15-minute dose of red light significantly blunted that typically sharp post-meal blood sugar surge. This suggests that RLT appears to stimulate the body to handle sugar more effectively after eating. Almost primes the system, you could say. Dr. Michael Pauner, who was the lead author of that groundbreaking study, was quoted stating quite unequivocally, "Our study has shown that we can use a single 15-minute exposure to red light to reduce blood sugar levels after eating." And while this initial study was rigorously conducted on individuals without a diabetes diagnosis, the authors themselves were quick to highlight the significant potential for these findings. They saw how it could translate into practical strategies for improving diabetes control. Why? Because it's well established that harmful glucose fluctuations, those sharp spikes and subsequent crashes that occur after meals, they're major contributors to tissue damage, accelerated aging, and the development of long-term complications. That applies in both diabetic and non-diabetic individuals. So any safe and effective method to lessen these spikes could be incredibly valuable for long-term health, regardless of one's current metabolic status.
It's truly fascinating and honestly almost counterintuitive, isn't it? To think that simply shining red light on your back could lead to lower blood sugar systemically? How does this actually work? What's the core mechanism that explains such a profound effect?
Yeah, the elegance of this mechanism where, a simple application of light can have such profound systemic effects is pretty remarkable. And while the full cascade of events isn't yet completely mapped out, the central player in the hypothesized mechanism is pretty unequivocally our cellular energy factories, the mitochondria.
Right, the powerhouses.
Exactly. These are the tiny bean-shaped powerhouses within nearly every cell in our bodies, tirelessly working to produce energy. The prevailing theory, and it's quite well supported now, is that specific long-wavelength red and near-infrared light, precisely those in the 650 to 900 nanometer range we talked about, they possess this unique ability to penetrate into the skin and underlying tissues, and they directly boost mitochondrial activity. This energetic boost then leads to a greater production of ATP adenosine triphosphate.
The cell's fuel.
The cell's fundamental energy currency, exactly. It's the fuel that powers almost every cellular process. So if we connect this to the broader picture of metabolism, an increase in ATP production basically signals to the cell that it's in an active, energy-demanding state. This heightened demand for fuel, in turn, causes more blood sugar, or glucose, to be taken up from the bloodstream and burned for energy. You can kind of think of it like this. In essence, red light gives your cells a metabolic kickstart, right? An energetic nudge. So they become more efficient and proactive in drawing glucose out of the bloodstream to power up. And that 2024 study actually provided some compelling indirect evidence for this precise mechanism. They measured exhaled carbon dioxide, which is a direct byproduct of cellular metabolism, essentially, what's produced when your cells are burning fuel. And what they found was that carbon dioxide levels were significantly higher in those exposed to red light, indicating that their cells were indeed more actively engaged in burning fuel. Now, what's truly fascinating here, and you touched on this, is that the beneficial effect of RLT on blood sugar doesn't appear to be just confined to the area where the light is applied. It seems profoundly systemic.
Right, they only lit up the back.
Exactly. In that 2024 study, they only illuminated the participants' backs, yet their glucose levels dropped throughout the entire body. Researchers believe this widespread benefit is due to something called an abscopal effect. It's a phenomenon often observed in various therapies, like radiation sometimes, where treating one part of the body can trigger beneficial responses in distant, untreated parts. In this specific context, it suggests that cellular signaling triggered in one illuminated region can somehow communicate benefits around the entire body, effectively sending out a metabolic all-clear signal, perhaps. We've actually seen this illustrated in previous animal studies, which provides further support for this systemic reach. It's not just a one-off finding. For instance, shining 670 nanometer red light on just a single area on the backs of mice improved symptoms in models of Parkinson's disease, a condition affecting the brain, far from the back. Even more relevant to our discussion today, it improves symptoms in a model of diabetic retinopathy that's a severe eye disease by boosting cellular energy not just locally, but in distant organs as well. So the systemic reach is incredibly encouraging. It implies that a convenient, targeted RLT session, maybe applied to your back or over large muscle groups like your thighs, might confer body-wide metabolic benefits, not just localized ones. The exact mechanisms for this widespread communication are still being fully worked out, but theories include the release of signaling molecules into the bloodstream, maybe effects on the nervous system, or even changes in the inflammatory status throughout the body. But the key takeaway is that you don't necessarily need to illuminate every single cell. Strategic application seems to have broad effects.
So for people actually living with diabetes, especially the millions grappling with type 2 diabetes, these findings really do open up some profoundly exciting possibilities. I mean, think about it. If a brief, non-invasive red light session can potentially reduce post-meal blood sugar spikes by around 30% in healthy individuals, imagine the potential benefits for those who struggle daily with chronically elevated and rapidly fluctuating blood sugars. We know that elevated and rapidly fluctuating glucose levels are a hallmark of diabetes, right? And they're well known to lead to long-term complications, progressively damaging various tissues and organs, everything from eyes to kidneys to nerves. So in this context, RLT could potentially act as a gentle, drug-free tool to significantly improve glycemic control. And it could beautifully complement all the existing proven strategies we already rely on, like careful diet, regular exercise, and of course, physician-prescribed medications.
Exactly. And the early evidence in diabetes patients themselves is exceptionally promising, building directly on that foundational understanding we've just discussed. There was a small but significant clinical trial conducted in 2023 that specifically tested photobiomodulation on patients already diagnosed with type 2 diabetes. This trial used near-infrared light, an 830 nanometer wavelength, and applied it to multiple large muscle areas, arms, and legs. It was designed as a crossover study, which is a strong design. The 10 participating patients received different doses of RLT or a sham treatment, both with and without their usual diabetes medications. This allowed for direct comparison within the same individual, and the researchers observed a clear dose-dependent reduction in blood glucose after RLT, meaning the higher the effective dose of light, the greater the reduction in blood sugar. That makes sense. With an optimal light dose, patients' blood sugar levels dropped and, importantly, remained significantly lower for an impressive duration up to 12 hours post-treatment.
12 hours. It's quite a long effect.
It is, yeah. That prolonged effect is particularly noteworthy for daily management. Crucially, the total glucose exposure, think of it as the overall sugar load in their bloodstream over time, what scientists call the area under the curve, was significantly reduced when red light was applied. That indicates profoundly improved glycemic control. And what's even more notable, perhaps, is that RLT was effective both with and without standard oral hypoglycemic drugs.
Wow, okay.
And the researchers even found a powerful trend where combining RLT with medication showed even better control, lower overall glucose exposure than medication alone.
A synergistic effect.
Exactly, a synergistic effect, which is incredibly valuable. So in essence, photobiomodulation demonstrated a time and dose-responsive ability to reduce blood sugar in type 2 diabetic patients. This finding perfectly aligns with, and indeed extends, the healthy volunteer study we discussed. It unequivocally suggests the beneficial effect translates directly to those who already contend with insulin resistance. And supporting this human evidence, earlier animal studies have also consistently shown that red and infrared light can significantly ameliorate diabetic conditions. For example, a 2021 study in diabetic mice found that repeated photobiomodulation using a 635 nanometer wavelength applied over several weeks led to a significant and sustained lowering of both fasting blood glucose and insulin resistance in the animals. The treated diabetic mice showed much better glucose tolerance and insulin sensitivity compared to their untreated counterparts. Diving deeper into the mechanism, RLT in these mice essentially seemed to supercharge their muscle cells' mitochondria, It activated key enzymes like cytochrome oxidase, which acts a bit like the ignition switch for the whole electron transport chain, boosting cellular respiration. This activation dramatically boosted ATP, the cell's energy currency, and kicked off a cascade of signaling that ultimately improved the muscle's uptake of glucose from the bloodstream. Essentially, red light therapy re-energized the diabetic mice's muscle cells. It triggered profound insulin-like effects like greater activity of GLUT4 glucose transporters. Those are the cellular doorways for glucose and more glycogen storage, which is how muscles store excess glucose.
So it helped the muscles take up more sugar.
Precisely, which effectively brought down their blood sugar levels. This mechanistic insight that RLT can directly enhance insulin signaling pathways in skeletal muscle is extremely exciting for diabetes treatment, primarily because skeletal muscle is the single largest site of glucose disposal in the body. It means RLT might directly help overcome the core problem of type 2 diabetes, which is insulin resistance, by making muscle cells more responsive and, quite literally, hungry for glucose.
That's incredibly detailed, and it really brings us to a very practical application, doesn't it? One could potentially envision using RLT before or after meals to really smooth out those otherwise drastic postprandial blood sugar spikes. The human studies we discussed actually used a single exposure prior to a glucose challenge and consistently saw these flatter, healthier glucose curves. So if those results continue to hold up in larger, more diverse trials, you might, maybe in the future, be advised to simply sit in front of a red light panel for 10 to 15 minutes before dinner. The underlying idea would be to proactively mitigate the usual glucose surge that inevitably comes from the meal itself, preventing that overwhelming metabolic burden. Reducing these spikes could prevent that debilitating roller coaster effect of high and low blood sugars that so many people with diabetes experience. Imagine trying to navigate your day with your energy constantly spiking and crashing. It affects everything: concentration, mood, stamina. A therapy that can smooth that out would be life-changing for so many, and potentially reducing long-term damage to delicate blood vessels and other vital organs, which we know get ravaged by chronic glucose fluctuations. It's a simple, non-pharmacological approach that could make a genuinely meaningful difference to daily life.
Absolutely. But if we zoom out and connect this to the broader picture, it's really crucial to emphasize that RLT would serve as a complementary therapy.
Yeah.
It's not a replacement for established life-saving interventions.
Right, that's key.
Definitely. Standard treatments like careful, medically supervised diet modification, regular, appropriate exercise, physician-prescribed blood sugar-lowering medications like metformin or insulin, and other doctor-recommended measures, these remain the absolute non-negotiable foundation of diabetes care. RLT is not a substitute for these proven therapies. That cannot be stressed enough. Instead, it could become a powerful adjunct, an additional valuable tool in the toolbox to further improve glycemic control and maybe even potentially reduce medication burden, but always under careful medical supervision. The significant advantage here is that it would likely come with minimal additional burden to the patient's daily routine. It's simply exposing the skin to light, right? And has no known chemical side effects since it's not a drug. Researchers are truly drawn to the elegance of the idea that red light could help treat or manage diabetes simply by applying red light to the skin for a prescribed amount of time without needing additional needles or pills. It offers a non-pharmacological avenue for support. And reassuringly, trials conducted so far consistently indicate that using RLT alongside existing diabetes medications does not increase any risk of dangerously low blood sugar or hypoglycemia.
That's good to know.
It is. A recent comprehensive review of photobiomodulation in diabetes explicitly noted no adverse effects were reported, and importantly, there was, quote, no increased risk of hypoglycemia when PBM was combined with hypoglycemic treatments. This is a critical safety point. It suggests that red light works by gently nudging the body's natural metabolism to handle glucose more efficiently, optimizing its inherent capabilities rather than forcing it beyond safe physiological limits. Patients in these studies tolerated the therapy exceptionally well, with no significant side effects observed. Nonetheless, and this is vital, for anyone with diabetes interested in exploring RLT, it is absolutely essential to do so under strict medical guidance. You must never ignore your doctor's advice or prescribe therapies in favor of light alone. Always consult your healthcare provider before making any changes to your diabetes management plan.
Okay, so beyond simply managing the day-to-day blood sugar numbers, RLT seems to offer another truly exciting dimension: its potential to actually alleviate some of the devastating diabetes-related complications that so many patients face down the line. As we know, chronic high blood sugar progressively damages various tissues throughout the body. It leads to this cascade of often debilitating problems like peripheral nerve pain, excruciatingly slow wound healing, severe eye disease, progressive kidney issues. The list goes on. So researchers are actively investigating if RLT's well-known cell-energizing and anti-inflammatory effects might directly address some of these serious complications, offering a more holistic approach that supports the body's own intrinsic repair mechanisms.
Yes, and what's truly fascinating here is the specific impact on these complications and really the breadth of areas being explored. Let's start with peripheral neuropathy.
Nerve pain, tingling.
Exactly. Nerve damage in the limbs, often causing chronic pain, uncomfortable tingling, numbness. It makes daily activities difficult and increases the risk of injuries, especially in the feet, which can go unnoticed. It's a common and particularly challenging complication with very limited conventional treatment options, unfortunately. RLT is being explored as a therapy to not only reduce that neuropathic pain, but potentially even to restore nerve function itself. The underlying idea is that red or infrared light can improve crucial blood flow to those tiny nerve fibers, which are often compromised in diabetes, and stimulate vital repair processes within the nerves themselves. According to a recent comprehensive review, RLT has shown significant promise in reducing pain and improving sensation in people with diabetic neuropathy, sometimes even restoring the ability to feel light touch or temperature, which is critical for preventing unnoticed injuries. Some studies, specifically those using monochromatic infrared energy on the feet, have even reported improved nerve conduction velocity and sensitivity in patients, alongside that vital pain reduction. The mechanism here is likely tied to boosting cellular energy, ATP, and reducing chronic inflammation within those delicate nerve cells, which helps the nerves to heal or maybe just function more effectively. Patients who have tried light therapy for neuropathy have sometimes anecdotally reported profound relief, experiencing better foot sensation and less burning pain after a course of treatments. Though it's important to note results can vary, and more rigorous, larger-scale trials are definitely underway to solidify these findings. Okay, next let's consider wound healing, especially those stubborn diabetic ulcers.
A huge problem.
A massive problem. High blood sugar inherently impairs the body's natural ability to heal, making people with diabetes highly susceptible to chronic, non-healing foot ulcers and other wounds. These can resist healing for months or even years, sometimes tragically leading to amputation. RLT has well-documented pro-healing effects on skin and tissues. This is known. It's due to its ability to stimulate cellular growth, boost circulation, and reduce inflammation. So, in the context of diabetic ulcer care, low-level laser or LED therapy has been utilized to stimulate circulation and promote tissue repair. Early research indicates that red light exposure can genuinely speed up ulcer healing. In one particular study, ulcers healed significantly faster and more completely when treated with RLT. This is likely due to increased blood flow, accelerated collagen synthesis, and the faster growth of new, healthy tissue in the affected area. Patients also often experience reduced wound pain with the light therapy, which is a significant quality of life improvement in itself.
That reminds me of those NASA stories.
Exactly. These findings actually align with serendipitous observations made by NASA decades ago. They discovered that red LEDs, initially developed for plant growth in space, also helped astronauts' minor injuries heal quicker because of their cellular regenerative properties. While RLT for wound healing isn't yet standard care across the board, it is being adopted as an adjunct in some specialized clinics to improve diabetic foot ulcer outcomes. It's seen as a low-risk intervention that could potentially reduce the need for more invasive procedures, including amputations, if it helps these challenging wounds close sooner. High-quality clinical trials are still needed to precisely establish how effective it is and in which specific ulcer cases it works best, but the concept is very plausible given what we know about light-stimulating cellular repair. Then there's eye health, specifically diabetic retinopathy. This is where chronically high glucose levels progressively damage the delicate retinal blood vessels and neurons. It's a leading cause of vision loss and blindness in people with diabetes. Amazingly, RLT might have a crucial role here too. The retina is an incredibly metabolically active tissue, highly dependent on efficient energy production. Some researchers have tested whether enriching the retina, or even the body in general, with these nourishing wavelengths of light can help preserve retinal function. Animal studies in this area are very promising. As we mentioned earlier, shining red light on diabetic rodents, even just on their bodies rather than directly into their eyes, led to improved retinal health and function, slowing the progression of vision impairment.
That's that abscopal effect again.
Quite possibly, yes. The red light likely boosted ATP production in the retinal cells or significantly reduced oxidative stress, thereby protecting these vulnerable cells from damage and slowing down disease progression. In fact, separate studies in humans, though with non-diabetic aging eyes, have found that brief, regular exposures to 670 nanometer light can improve retinal sensitivity and visual function, especially when given in the morning. Now, RLT is certainly not a replacement for established treatments like laser surgery or injections for advanced retinopathy. Absolutely not. But it could emerge as a supportive or even preventative therapy to help keep the retina healthier for longer. It's non-invasive and could potentially be as simple as a daily look into a red light device for a few minutes. For diabetics, protecting eyesight is paramount, and this light-based approach might become an important part of a preventative strategy against retinopathy, pending further larger-scale human research. And looking even broader, we should consider the kidneys and other organs. Chronically high blood glucose over time also causes significant damage to the kidneys, leading to diabetic nephropathy, a leading cause of kidney failure. It also contributes significantly to cardiovascular disease, nerve damage throughout the body beyond just the limbs, and other systemic organ damage. Researchers are just beginning to ask if photobiomodulation's systemic benefits, its ability to penetrate and influence cells throughout the body, could extend to vital internal organs like the kidneys, heart, and even the brain. There is significant interest in whether improving mitochondrial function via RLT could mitigate chronic inflammation or oxidative stress in these organs, which are key drivers of diabetic complications. So far, this is mostly theoretical or in very early experimental stages, often in animal models, but the potential is undeniably there for RLT to act as a broad protective agent. One intriguing, albeit frontier idea even proposes using tiny LED devices endoscopically or via catheters to shine light inside the body in the gut maybe, or within blood vessels to treat metabolic diseases directly at their source.
Wow, internal RLT.
Yeah, futuristic stuff. Additionally, RLT has also shown some antidepressant effects in separate research, and it could potentially help with mood disorders or chronic fatigue, which are common and important factors for the overall quality of life in people with diabetes. All these are indeed frontier ideas exciting, but absolutely requiring much more rigorous, large-scale evidence before clinical application. But overall, it's clear that red light therapy is being investigated in a remarkably wide array of diabetes-related contexts, literally from head to toe. The common thread running through all these potential applications is this elegant idea that improving cellular energy, primarily through enhanced mitochondrial function and reducing inflammation, can yield multifaceted benefits across various tissues and organ systems. These are fundamental biological processes. While early results are certainly positive and highly encouraging, for instance, a recent meta-analysis found photobiomodulation to be both effective and safe for relieving diabetic neuropathy symptoms. It's important to acknowledge that larger, high-quality clinical trials are still critically needed. We need to confirm the true extent and consistency of these benefits across diverse patient populations. But if proven, RLT could become a genuinely holistic adjunct treatment, improving not only blood sugar numbers, but also directly addressing the devastating complications that make diabetes such a challenging condition to live with.
You know, what really struck me as I was going through all this research, the review from Dan Blackburn, was how the implications of light on metabolism actually extend beyond just these therapeutic devices or panels. It literally touches on the very light we live in daily, the light that surrounds us constantly. If you think about it from an evolutionary context, human beings evolved under natural sunlight, right? Which has a wonderfully balanced spectrum of colors. Crucially, this includes ample red and infrared light, especially pronounced at sunrise and sunset when the sun is low on the horizon, bathing us in these deeply penetrating wavelengths. We've spent millennia bathed in this natural full-spectrum light.
Exactly. And looking at the broader context, the modern problem is that we now spend the vast majority of our lives indoors, often under artificial lighting that is starkly different from natural sunlight. This artificial illumination tends to be heavy in blue wavelengths and, critically, very deficient in red and near-infrared light. Think about modern LED lights, the screens of our phones, tablets, computers. They all emit a significant amount of blue light, but almost no near-infrared. And this matters profoundly because, as we noted earlier, long-wavelength red and infrared light penetrate our tissues and actively support mitochondrial function. They act almost as a crucial nutrient for our cells. Blue light, by contrast, doesn't seem to support mitochondria in the same beneficial way. In fact, chronic excess blue light exposure without the balancing restorative presence of red light could potentially impair mitochondrial efficiency over time. It could act as a subtle stressor on our cellular powerhouses. Professor Glenn Jeffrey of University College London, who actually co-authored that landmark 2024 red light study we talked about, has raised significant concern about this. He worries that we have inadvertently created red light deficient environments that may very well be undermining our metabolism on a global scale. He explains it quite clearly, stating, "Sunlight has a balance between red and blue, but we now live in a world where blue light is dominant. LED lights are dominant in blue and have almost no red. This reduces mitochondrial function and ATP production, hence our internal environments are red-starved."
Red-starved environments. It's a striking phrase.
It is, isn't it? And he goes on to put forth a very provocative yet deeply plausible hypothesis that chronic, prolonged exposure to this blue-rich, red-poor lighting could drive disrupted blood sugars that may, in the long run, contribute to diabetes. In other words, the very lighting in our homes, offices, schools, public spaces might be subtly, over years and decades, raising our insulin resistance or increasing our diabetes risk, all by starving our cells of the restorative red and infrared wavelengths they evolved with and desperately need. He refers to this as a potential health time bomb for our aging populations, suggesting that we might need to actively reintroduce red light, either through more natural sunlight exposure or maybe innovative new lighting solutions to maintain healthier metabolism and mitigate this unseen environmental stressor. And on the flip side, natural sunlight or even broad-spectrum incandescent light, which more closely mimics sunlight's full spectrum by including a warming infrared component, might actually be protective. It's important to remember that prior to the widespread adoption of LEDs and fluorescent lights in the 1990s, indoor lighting sources like traditional incandescent bulbs and halogen lamps emitted a warmer spectrum. They actually included a significant near-infrared component.
Right, those old warm bulbs.
Exactly. Those lights, while certainly less energy efficient than modern LEDs, at least provided a mix of wavelengths closer to what nature intended. With the dramatic global switch to LEDs and fluorescent lights, that spectral balance shifted dramatically toward blue and away from red infrared. Professor Jeffrey's hypothesis really underscores why this seemingly small change could have profound long-term health implications. This gives us another powerful reason to embrace simple, practical lifestyle recommendations. Spending more time outdoors is an easy, accessible, and highly beneficial one. Not only do you get crucial physical exercise, which itself is a powerful modulator of blood sugar, but you also soak in some therapeutic red and infrared light from the sun. Even on a cloudy day, much of the beneficial infrared still penetrates through. As one doctor commenting on the RLT research aptly noted, we always encourage our patients to go outside and exercise. This is another reason to encourage outdoor activities. Sunlight plus exercise could truly be a winning combination for maintaining optimal glucose control, reconnecting us with the light environment our biology is designed for.
So if we pull all these threads together, what does this all mean for you, the listener? It's profoundly eye-opening, I think, to realize that light itself is a kind of essential nutrient for our metabolism, just as critical maybe as the food we eat or the exercise we get. Circadian biologists have already taught us that blue light exposure at the wrong times, like late-night screen use, can profoundly disrupt your circadian rhythm, and that in turn directly impacts your glucose metabolism and insulin sensitivity the very next day. Now, this conversation expands to include the compelling idea that a chronic lack of red and near-infrared light might also be detrimental to our metabolic health over the long term. In practical, actionable terms, this suggests that simple lifestyle tweaks could make a difference. Perhaps consistently taking morning walks in the sun, which is naturally rich in red and infrared content, especially early in the day. Or maybe even consciously incorporating full spectrum or infrared-emitting lamps into your workspace. Or occasionally using a consumer red light therapy device for general wellness and cellular support. All these could contribute meaningfully to healthier mitochondrial function and improved glucose handling. These lifestyle tweaks, while still somewhat speculative in terms of long-term diabetes prevention data, are deeply grounded in this emerging understanding of light's profound impact on human biology. They underscore a broader, crucial point. Prevention is almost always better than cure, right? Nurturing our metabolic health through a truly holistic lifestyle, with perhaps a conscious and generous dose of healthy, balanced light, might just significantly reduce your chance of developing diabetes in the first place. Okay, but given all this promise and the pervasive nature of light, a vital question that immediately comes to mind is, what about the safety? Is this truly as benign as it sounds, or are there important considerations for listeners to be aware of before, diving in?
That's an excellent and crucial question to address. Safety is always paramount for any emerging therapy. And one of RLT's major appeals is truly its remarkable safety profile based on current evidence. It's generally considered gentle, completely non-invasive, and patients consistently report that treatments are relaxing. If they feel anything at all, it's typically just a mild, soothing warmth from the light devices, a sensation often described as comforting. And importantly, the specific wavelengths used, typically in that 600 to 900 nanometer range, do not carry the risks of sunburn, cellular damage, or DNA damage that ultraviolet light does. That's a common misconception, but red and near-infrared light operate on a completely different part of the spectrum. Furthermore, in all the blood sugar studies and reviews conducted to date, there have been no adverse effects or cases of dangerously low blood sugar hypoglycemia reported, even when RLT was combined with powerful diabetes medications.
That's a critical point.
Absolutely. It's a critical safety finding for a therapy intended for blood sugar management. Patients consistently tolerated the therapy exceptionally well with no significant side effects observed. However, while the safety profile is excellent, there are still important caveats and responsible considerations for anyone interested in exploring RLT. It's always wise for individuals to consult a healthcare provider before self-treating with RLT, especially if you have serious underlying health conditions like diabetes or if you are on medications that might interact in unforeseen ways. Better safe than sorry. And as with any therapeutic modality, proper use is absolutely key to both safety and efficacy. This means understanding the correct light intensity for your specific device, the appropriate duration for each session, and maintaining an appropriate distance from the skin to avoid any minor burns or potentially eye strain. You should never stare directly at high-intensity LED panels, especially those emitting near-infrared light, which is invisible to the eye but still impactful. Many devices come with protective eyewear for this reason, and it's wise to use it. Looking ahead, the field of photomedicine is rapidly expanding. Larger, more robust clinical trials are almost certainly on the horizon to rigorously verify RLT's benefits for diabetes and other metabolic conditions across diverse populations. There are still several key scientific and clinical questions that need to be answered definitively. For example, what is the truly optimal dose and timing of RLT for maximal glycemic control? Should it be daily? Just before meals? For how many minutes? Which specific wavelengths are most effective? Is it red, near-infrared, or maybe a precise combination of both that yields the best results? What percentage improvement in blood sugar can be sustained in individuals with diabetes over months or even years of consistent therapy? And ultimately, does adjunctive RLT genuinely translate into fewer long-term complications like neuropathy or retinopathy or a measurably better quality of life for people living with diabetes? Those are the big outcome questions. Researchers will also be exploring if certain patient subsets might benefit more. Perhaps those with milder disease, those recently diagnosed, or maybe even those with specific genetic makeups related to their mitochondrial function. If these overwhelmingly positive results continue to be replicated and verified across larger multi-center trials, we could realistically envision a future where red light therapy becomes an accepted, maybe even routine part of comprehensive diabetes care.
Like getting a prescription for light.
Potentially, yes. For example, a doctor might literally prescribe 20 minutes of red light panel use per day, much like they prescribe a medication today, as a foundational aspect of management. This could potentially help a patient reduce their drug dosage under medical supervision or achieve better control of their HbA1c, that crucial measure of average blood sugar. There's also significant potential for at-home RLT devices specifically tailored for metabolic health. Companies already sell consumer red light devices for skincare and pain relief. The same underlying LED technology could be readily adapted. You could use it on the abdomen, back, or limbs to effectively target internal organs and large muscles for profound metabolic benefits. It will be crucial, though, that these devices, if marketed for medical purposes, are of true medical-grade quality, delivering the right wavelength and consistent energy dose. And consumers need clear, evidence-based guidance on safe and effective usage. The barrier to entry for this technology is relatively low. LED lights are widely available, not prohibitively expensive, which raises hope that if proven effective, RLT could be a truly cost-effective and accessible therapy for many. In fact, whole-body red light beds and infrared saunas are already available in some wellness centers. These could certainly gain more scientific credibility and wider adoption as more robust clinical data emerges. Of course, healthy scientific skepticism is always warranted and remains important until larger, more definitive evidence is in.
Absolutely.
Experts in the field urge caution. They note that while early studies are highly encouraging and truly exciting, it's still too early to determine if red light therapy will become a viable, widespread diabetes treatment in mainstream clinical practice. Any new therapy, especially one with such broad implications, must undergo rigorous gold standard testing for both efficacy and long-term safety across diverse populations. RLT for diabetes is no exception. It's an intriguing concept that needs consistent, independent confirmation across larger scales. As one endocrinologist put it remains to be seen if the studies can be verified and replicated before it transitions from promising research to standard medical protocol. So, for now, you should probably view RLT as a wellness intervention with compelling potential metabolic perks rather than a proven medical therapy for diabetes. It can be used in addition to doctor-prescribed treatments, ideally with explicit medical approval, but it should absolutely, unequivocally not be used in place of them. It's a supportive tool, not a standalone cure at this stage.
We've taken a truly illuminating deep dive today, haven't we, into how red light therapy is profoundly impacting and, frankly, maybe redefining a new frontier in metabolic health. We've seen how a surprisingly simple 15-minute light exposure can meaningfully reduce blood sugar levels, opening the door to a host of possibilities for both diabetes prevention and its sophisticated management. From re-energizing our cellular powerhouses, the mitochondria, and giving our metabolism that vital kick, to potentially easing the debilitating effects of diabetic complications like peripheral neuropathy and significantly improving wound healing. RLT shows immense, multifaceted promise. And what's uniquely appealing and compelling about it, I think, is that it's a gentle, non-invasive nudge to our body's incredible natural healing and metabolic processes, without the significant side effects or pharmacological strain that often come with traditional medications.
Exactly. And if we connect this to the bigger picture, while the excitement surrounding RLT is absolutely warranted given these early results, it's important to maintain that realistic, balanced perspective. The concept of lighting up our cells to treat or manage complex metabolic conditions like diabetes is still relatively new in the realm of mainstream medicine. More extensive, long-term clinical trials are definitively needed to translate these promising early successes into universally accepted standard medical practice. Over the next few years, we will likely see a surge in studies that will tell us how well RLT truly works for larger, more diverse populations, and precisely how it should best be implemented in various clinical scenarios. If the data continues to stay positive and robust, doctors in the future might routinely integrate RLT into their patients' diabetes management routines, perhaps even prescribing light sessions after meals or issuing personal red light panels for home use to help patients manage their blood sugars. This would represent a truly significant paradigm shift, really, in how we approach metabolic disease, eloquently integrating a physics-based therapy with traditional biochemistry-based treatments. What's fascinating here, though, is that you don't necessarily have to wait for decades of research to explore this connection yourself in a general wellness sense. You can take
The intersection of light and health is such an age-old story, from the sun cures of past centuries to modern laser medicine. But applying it so precisely and effectively to the complex challenge of diabetes is truly a novel and hopeful chapter in that unfolding story. The research so far, especially the work compiled by Dan Blackburn that we leaned on today, undeniably shines a hopeful light on innovative new ways to enhance metabolic health. It promises a future where light truly is medicine in some form. As one science writer playfully quipped, when it comes to emerging diabetes treatments, this one is literally a case of better light than never. So what stands out to you from today's deep dive? And how might you consider your own light environment differently after hearing all this remarkable information? Thank you for joining us on this fascinating deep